Welcome back, everyone, to the Wednesday morning lecture with your host, me, Jodie Rogers. Today we will be speaking about personality disorders, and in this episode we will be discussing paranoid personality disorder. It's time for us to get to know PPD better. Paranoid personality disorder is a cluster A personality disorder as it involves or is characterized by odd or eccentric ways of thinking. Paranoid personality disorder is defined as a pervasive, persistent, and enduring mistrust and suspiciousness of others, and is a profoundly cynical view of others and the world. A brief history of PPD and the DSM is that in 1921, German psychiatrist Kraepelin first proposed three distinct presentations of paranoia that correspond to the diagnoses of schizophrenia, delusional disorder, and paranoid personality disorder. However, due to the lack of delusions and hallucinations, the PPD was then classified as its own cluster A personality disorder and appeared in the DSM-3 in 1980. According to the DSM-5, those with paranoid personality disorders are only diagnosed if they fit 4 of the following 7 criterion. A1 suspects that others are exploiting, harming, or deceiving him or her without a sufficient basis. A2 often preoccupied with doubts that are unjustified concerning loyalty or trustworthiness of friends or associates. A3 is reluctant to confide in others due to unwarranted fear of information being misused or maliciously used against him or her. A4 associates common remarks or events with demeaning or threatening meanings or intent. A5 bears grudges persistently and can be characterized by unforgiving and cynical. A6 perceives attack on character or reputation as not apparent to others and often is quick to counteract or react angrily. A7 is usually plagued with recurrent suspicions without justification, especially regarding fidelity of spouse or sexual partner, often making relationships difficult to obtain. Associated features with PPD include that 75% of those diagnosed with paranoid personality disorders have been diagnosed with another personality or mood disorder too. It's important to know that paranoia or paranoid personality disorder before the onset of schizophrenia is called pre-morbid paranoid personality disorder. It's important to know that individuals with paranoid personality disorder do not experience delusions or hallucinations, and often it does not occur exclusively during the course of schizophrenia or other mental disorders. Most associated personality disorders include borderline personality disorder, antisocial personality disorder, and avoidant personality disorder. And most associated mood disorders include major depressive disorder and generalized anxiety disorder. The prevalence of PPD is estimated to be around 2.4 to 4.2% of the population and is most likely to occur in groups of ethnic minorities and those with impaired hearing. In gender, paranoid personality disorder is more diagnosed within the male population than in that of the female population. It's important to note that often these statistics can be skewed, as those who often have personality disorders don't always get diagnosed due to sociocultural differences or beliefs on mental disorders. The onset of PPD often occurs during the late teens or early adulthood. However, there is evidence that shows that onset can occur after a traumatic experience that can trigger severe symptoms of paranoia and eventually, or in severe cases, develop into paranoid personality disorder. Stability is often inconsistent and unstable and has shown less deterioration than other personality disorders. As we move on to the development of paranoid personality disorders, it's important to know what developmental psychology is. Developmental psychology is the study and approach that aims to determine and explain the growth, change, and consistency of the way individuals think, feel, and behave throughout their lifespan. In psychology, it is important to note that the development of mental disorders are not mutually exclusive and involve the complex interaction of biological, psychological, and social causation, and that is why we look at George Engel's biopsychosocial approach. When describing the etiology of paranoid personality disorders, we have to look at the biological factors, environmental factors, and psychological factors. The biological factors include genetic predisposition, brain chemistry. Environmental factors include traumatic events in childhood and social environment. And psychological factors include the cognitive functioning of the individual. Those with PPD often have a genetic predisposition by their parents or close relatives with personality disorders, especially those such as schizophrenia or borderline personality disorders. Those with parents who have personality disorders often have a larger chance of being diagnosed with another or the same personality disorder, thus suggesting in many studies a genetic link. However, there has not been clear studies that show there is a definite link to genes with paranoid personality disorders and those who have parents who suffer from the same disorder. Brain chemistry. Brain chemistry includes the encoding of neurotransmitters and enzymes within the serotonergic and dopaminergic systems. Neuroimaging studies show discrepancies for those with personality disorders, mainly in the frontal lobes, temporal lobes, and limbic-paralimbic systems. Studies have especially shown that substances such as alcohol, marijuana, and cocaine can have effects on brain chemistry that ultimately contribute to severe paranoia that can develop into paranoid personality disorder with severe substance abuse cases. Social factors such as 3, trauma and stress reaction shows that paranoid personality disorder has a connection to early childhood trauma, whether it be physical, emotional, psychological, or even ongoing and persistent social stress, such as bullying. Traumatic stresses or risk factors of PPD include physical abuse, emotional trauma, or even social discrimination, often associated with race or class. These factors often occur during early childhood or a significant phase of change in their lives, such as moving from one country to another, but can also be traced back to the parenting of a child that has formed mistrust for those who are caring or parenting them. A psychological factor to determine the development of PPD could be cognitive functioning. Studies have shown that the cognitive functions that determine the trajectory and severity of paranoia can include low task orientation, persistence, flexibility, and high perseverance, all contributing to paranoia ideation, and in severe cases can be the contributor to the development of paranoid personality disorder. And now we arrive at the question, can you prevent paranoid personality disorders? Studies have shown that even though there is no proven way to prevent paranoid personality disorder, there are treatment strategies put in place that aid in the adaptation to functioning better for their everyday lives, such as medications like antidepressants or anti-anxiety, cognitive behavioral therapy, especially spoke therapy, ways of improving their coping skills when feeling influx of paranoia, and in severe cases, hospital admissions. The influence of paranoid personality disorder on relationships. Individuals that suffer with paranoid personality disorder often struggle to form secure and meaningful relationships as they experience the maladaptive feelings of mistrust and suspiciousness. Children or teens tend to view all interactions with others with the belief that they intend to harm them or humiliate them, and therefore retreat into isolation from the rest of their peers, sometimes resulting in being bullied or ridiculed by others. This aids in the further development or severity of paranoid personality disorder. Those diagnosed with PPD who have already established close relationships with a family or friend often struggle with jealousy, suspicion, and controlling tendencies. And this means that those who have these relationships with this individual often have to provide a lot of reassurance. Arrive at the cultural context of paranoid personality disorder. Personality disorders are often diagnosed and treated through the lens of a Western medicine and diagnosis. However, each culture experiences human condition differently. Within South Africa, there is multiple cultures that view personality disorders based on their socioeconomic status, religion, and beliefs. He is personified and characterized as having extreme low self-esteem, as well as having severe paranoia. He fits the following 4 criterion of the DSM-5. 1. He suspects that others are exploiting, harming, or deceiving him without a sufficient basis. 2. He associates common remarks and events with demeaning or threatening meanings of intent. 3. He bears grudges persistently and can be characterized as unforgiving and cynical. This is known in the way that George just can't let anything go. And 4. He is usually plagued with recurrent suspicions without justification, especially regarding fidelity of spouse or sexual partner, often making his relationships very difficult to obtain. I hope today has been an insightful session on paranoid personality disorder. Enjoy the next episode of our Wednesday morning lecture.